Hi, my name is Monica Oxford. I'm Director of NCAS Programs and Promoting First Relationships Programs. I'm here to tell you a little bit about what PFR is and what it might do for your families on your caseload. Promoting First Relationships, or PFR for short, was evaluated in child welfare here in Washington State, which is pretty exciting. It's in our own backyard. We evaluated PFR on families who had received a report from CPS, families who were in foster care, reunified birth families, and kin providers in 2 different randomized clinical trials. In these studies, we found promoting first relationship improves parental sensitivity. That finding is we videotape parents pre and post the intervention and have somebody who is blind to the treatment that the parent received code the tapes for sensitive caregiving, whether or not the parent is responding to the social and emotional cues of the child, whether or not the parent is comforting a child when they're distressed. And we found that PFR in both studies improves parental sensitivity using these observations. We also found PFR increases parents' knowledge of child development. So what is it appropriate to expect for a 1-year-old or a 2-year-old? And it improved child outcomes, child competency, reduced emotional or affective communication errors, and in 2 pilot studies, smaller studies in these programs, we found impressive results on stress physiology. But what you might be most interested in learning about is our child welfare outcomes. Promoting first relationship improves child welfare outcomes for kids birth to 3. In the CPS study, we showed that receiving 10 weeks of PFR after a CPS report has been made reduces foster care placement by 2.5 times. That is a significant and very important reduction in foster care placements. In the foster family study, we found that PFR increases the likelihood that the foster or kin provider will adopt the child if the child becomes available for adoption, and decrease the number of separations that the child would have experienced compared to those who were in the control group. So these are really, really important child welfare outcomes. Now what I want to tell you a little bit is about the service. What is PFR? It's really brief, 10 weeks, which is great that we can get this kind of effect after 10 weeks. And we use videotape feedback, and we think that the videotape feedback is a really, really potent mechanism for change for parents. We go into the house, videotape the parent and child play, and then come back the next week and reflect on that videotape. We comment on the great things that parents do, and that's how we operationalize a strengths-based program. But when things are hard or strained, or the child has a temper tantrum, we're able to sit back and reflect on that with the parent. Try to ask questions to help them enter the mind of the baby and increase their insight into why children behave the way they do. And we reframe behavior as an underlying social and emotional need. This really seems to work well with parents. They really catch on to the concepts and are soon able to have that understanding of behavior, and then what they can do to support their child at those times that they have a social emotional need. Some people are worried. When we first started this program, folks in child welfare and other populations were very worried that it's very hard to implement something with videotape, that parents would be very reluctant to do it. We were worried too, but what we found was the exact opposite. Parents love the videotape because it's about them and their child. It's not about some abstract parenting method or rule, but see, this is what my child does, and then we can reflect on that together. It sometimes takes 1 or 2 sessions for the parent to feel comfortable, but our PFR providers are really trained to be sensitive and go at the parent's pace if they are uncomfortable. Also, the videos are destroyed afterwards, so that helps parents feel even safer doing this intervention. What we do know from the CPS study here in Seattle, Washington, was that if a parent had at least 1 PFR visit, 93% of them continued to the program's end. That's a pretty impressive retention rate. And I think that's because we build in strengths, we build in social emotional learning, and the video feedback, which is really potent. So Children's Administration has trained PFR providers throughout Washington, and they should be available in your community to refer to if you have a family in CPS who has a report and you perhaps want to reduce the chances of a foster care placement, or if you have families already in the child welfare system in a foster care placement, foster provider, kin provider, or a reunified birth family. So I hope this little information helps you and supports you in the really important work you do with child welfare families throughout Washington State. Thanks.